Welcome to Coffee and Conversation AI and Healthcare. We got my coffee. I'm Jen Hand, and I'm here with Sara Vasey from Providence. Welcome, Sara.
Thank you.
So we are excited today because Sara is a trailblazer in healthcare innovation. She is the EVP, Chief Strategy and Digital Officer at Providence. So she oversees digital innovation for Providence's integrated delivery network, which includes 52 hospitals, over 1,000 clinics, and serves over 5 million unique patients. So, Sara, at the Digital Innovation Group at Providence, I imagine you've seen the good, the bad, the ugly in the digital transformation space. So projects that have been successful and maybe projects that didn't go quite as well as you'd hoped. So what are some of the good or maybe the bad lessons that you've learned while experimenting with AI and digital tools so far in your time at Providence?
I wouldn't say anything has been bad necessarily, but they've all been good lessons, some more informative than others. Specifically related to AI, I think, it's not necessarily the technology itself. I mean, of course, we learn along the way a lot about the technology itself, but it's about how we communicate and operationalize technology within the healthcare context. And I know we'll get to this a little bit in terms of like how we work with clinicians in particular around AI and digital, but we need to do a lot of engagement, transparency, communication, bringing folks along. Otherwise, it just gets rejected because it can seem very risky, and especially with generative AI and all the hype around it, and the fact that everybody's learned the word hallucinations in this context, whether it's accurate or not. There's just a need to do a tremendous amount of education and ongoing sort of keep your foot on the gas, really, when it comes to driving transformation efforts. Then that's another difficult lesson actually that we've learned, which is that we thought, let's do a lot of innovation work, have a strong thesis around it, have a lot of rigor, and then hand it off to operating partners because they're the folks that really do it within the context of their day-to-day. The challenge is it's really hard to transform the day-to-day with technology. And it's important to have a dedicated partner, which we play that role increasingly rather than just handing it off once we've taken it to a certain point of, operational, clinical, and technological rigor. But it's really important to actually keep pushing for where are the sources of value? How do you how do you transform workflow? How do you ensure that the right types of data are going to the right places and being used in a way that's really valuable? So I think all of my messages are really the things that we've learned have been beyond the technology advances themselves. It's really about how you get healthcare to transform with technology. A lot of engagement, a lot of operationalization. Keep your foot on the gas. Don't just assume that it's going to do the things that you thought it was going to do without a lot of additional effort.
Yeah, and I like that you said the education piece, because I think when you're talking about day-to-day, people cling to their habits and their workflows. And, some people embrace change, but I think the majority of people, we kind of like our routine, and we like, even if we're open to the faster, more efficient, more transformative tool, sometimes there's a little bit of resistance there. So I think it's interesting. Yeah, that's a big lesson in there.
And folks who work on the front line are working harder than they've ever worked before. They are just grinding every single day, and it's really hard to add another thing into the mix or do something new within that context. So it's really important to have an extra pair of hands or support there for them. Even when it comes to things like digital self-service for our consumers, we do a tremendous amount of internal engagement and education, even if it doesn't require workflow changes, because questions might, for instance, come up for the clinicians, well, what does this mean? Or how do I use it? Or I got a notification in my Providence app about the fact that I need to get a colon cancer screening. What does it mean? Why do I need to do it? Right. So all of these things, they just need to be brought along with just as much as our consumers need to be brought along.
Yeah, and that's an important point. And one of the challenges people often talk about in the industry is the clinical adoption of AI. So if doctors, nurses, frontline staff, if they aren't on board and educated with adopting these tools, then the big AI transformation won't really move forward. So in some of the things that you've written and webinars or live posts that you've done, you mentioned using clinician feedback as you experiment with these tools as an important part of your process. So as you work alongside the clinicians to get their input in the AI tools, what kinds of insights have you heard from staff that you would think are really crucial and important?
The biggest insight I think I mentioned around transparency, it's like the outcome is important, but how you got to it is also really important. And so when it comes to, for instance, a lot of the AI models that we're testing, like folks want to know where was the decision made? How was the decision made? It might seem good on the surface, but edge cases will present themselves where we need to really understand the way by which a model resulted in what it resulted in. And so that was actually when we were working we have a conversational navigation platform which surfaces up to our patients as a chatbot, and we use Informatica as the symptom checking kind of deep vertical on that. That was one of the things that was most important to us, was to understand, like, as you're going through the symptom checking, what is the logic behind a result emerging? And so that's been the biggest insight is, and when it comes to like generative AI, as we've been thinking about that, and we use generative AI, you know, sort of, it's a blanket term, an umbrella term that kind of falls under a broader AI term, of course, but we think about it, we've actually been doing much more work on sort of the large language model side to understand for instance, parse intent of a user. So what are they actually trying to accomplish? What information do they need, or what tools do they need? And so the result of how we understood that intent to be a specific way, if you know, it's really important to know why we got there, and if something goes wrong, where did it go wrong? Right now, in the context of generative AI, it's actually very hard to say, well, where did something go wrong, or why did it understand something to be this way versus what the person actually intended, right? And so so being able to kind of track and have that continuity is one thing that we've gotten from our clinicians that's just absolutely essential. It can't be a black box. And when edge cases emerge, like, we can't screw it up. And the tolerance for risk is relatively low.
That why is such an important takeaway for me, because it almost innately creates buy-in when you can understand why something arrived at the point that it did. You know, and they talk a lot about ChatGPT, you know, unrelated to healthcare, but just how it's not very explainable. And especially in healthcare, when it's so important to have that outcome be explained, that to me is a huge takeaway, because then when clinicians can understand that why, when frontline staff can understand the path leading to the outcome, then it's just innately easier to buy into it.
That's right. Yep. Clinicians are scientists, right? And they want to know why something is the way it is. They want to apply scientific method. They want to apply their like rigorous approach to, you know, design and testing, and so the why is really important to them.
Yeah. So with that science, I think that's also a great point to bring into our conversation. So there's, of course, been tons of hype over AI in healthcare, especially these last 6 to 9 months. So given that our industry must be backed in science, rigor, clinical validation, what are your thoughts on health systems specifically using that AI while the regulations and guardrails are sort of still being formulated? I think we're sort of at this pivotal time, so I'd love to hear your thoughts on that.
Well, I don't think we can wait. Like, this is not a sort of serialized activity where you wait and you develop all of the guardrails first. Maybe in an ideal state, we would do that. And I know that there's a lot of hesitation around moving forward without mindfully sort of developing guardrails first. The reality of it is I don't think that's a possibility. It's already out there, right? And so we need to embrace it. We need to lean in. And this is why I've encouraged our system to lean in heavily. It's because it's actually really important for us to be able to shape guardrails in the context of healthcare, through actual learning, like as opposed to in theory, which, it's fine. And there are certain things like at the high, first principles level or whatever that we can apply in theory. But how it all kind of comes out is sort of TBD. So we need to lean in and then help shape the guardrails. Where we're learning is in lower risk kind of scenarios, so that we're not exposing folks, whether it's our patients or our clinicians, we're not exposing them to high risk sorts of things, and trying and like making them into guinea pigs, right? That's not the goal either. So really low risk types of scenarios, and in many cases, then using that to shape the guardrails. And so, the answer is I don't really know where it'll all come out. It's still a little bit early. We are leaning in to create guardrails for our own organization, from like how do we view our utilization of large language models and partnerships with folks within the generative AI and broader AI space. How we as a system utilize these things and work around, safety, equity, ethics, security and privacy, those types of things. And then I think there's actually opportunities more broadly across entities to come together to kind of have almost like, the creation of the internet. The internet was built on commonly shared protocols that ISPs kind of used to build what we all now utilize every day. And I think there are some cross-entity opportunities as well to create some guardrails, and hopefully not, maybe learn from our mistakes on how the internet has been created and, the path that it has taken. So I think it's, we got to do it in practice, not just in theory. Do some low risk use cases, look internally within our own organizations as well as across organizations to develop standards and protocols and guardrails.
And that makes it almost each company, each system utilizing AI, looking out for those ethical, safety, all the plethora of aspects of regulations that need to be understood. It's almost like taking it on ourselves. So as the regulations are being formulated and as things are happening, we also look at it in our own systems and in our own tools and with our customers, with clinicians, things like that. So I think that's a great point. And this idea of in theory versus in practice is important too, because if we wait, like what you're saying, by the time the regulations roll around, the growth will be stunted. We're already behind. So it's like, we'll even be farther behind. So I think it's a good point. In theory, we might be waiting for a perfect time for the regulations, for the guardrails to happen. And it's like, we got to throw that out and just keep taking that responsibility on ourselves.
I think there's a question as to like whether, when we say like from a regulatory standpoint, for instance, do the regulators have the tool set and the deep understanding of the science in order to develop guardrails at the appropriate sort of level of granularity, at the appropriate with sort of applicability associated with like it's really hard right now, for instance, it's really hard to QA across different use cases. It's really hard to understand the rationale behind various responses of generative AI. It's really hard to measure safety, biases, performance of solutions, etc. And like, are they equipped to be able to do that? Or does that need to come from somewhere else, from practitioners partnering? Maybe it's a public-private partnership, maybe it's something else, but who really understand the depth associated with use cases and then how you do those things within that.
Yeah, and I think you have a unique position with the Digital Innovation Group at a major health system. I mean, it's amazing that you're able to have a specific team of people looking at this, working on it every day to shape such an important piece of the healthcare transformation. So before we wrap up, if you don't know, Sara has her very own small hot sauce company called Yeah Boy. So I thought the most important question of our episode today is, any thoughts on using AI as your hot sauce business expands?
Oh my gosh. Well, I could think of a couple examples. One is like actually procuring our ingredients across the supply chain. Like that's actually a really hard thing to do, even though we're a very small scale. But getting high quality habanero peppers, for instance, can be really hard. And often, we do it the old school way where we like hoof it from one producer to another, out the quality ingredients ourselves. Another is, of course, in like demand generation and on the sort of go-to-market side of things. So demand generation and then both sort of push and pull, like sort of proactive outreach to our existing customer base, as well as to folks that haven't encountered us yet. So there's a lot of potential for AI there, but I think in everything, frankly, that we do, like as a, out there in the world, when it comes to capturing demand, like we could do a lot there. So,
well, listen, you're hearing it in real time. So Sara will keep us updated on how AI has not only transformed Providence, but also Yeah Boy. So thank you so much, Sara, for being a guest today on Coffee and Conversation, AI and Healthcare. And we'll see you in the next episode.
for having me, Jen.